Thank you so much for joining us. I'm Mabel, Jong, and we're back with our coverage from the World Healthcare Congress here in Washington, D.C. And I'm standing now with Shari Costantini, President of AAIHR, and also Bill DeVille, Ethics Chair of AAIHR. Welcome to you both.
Thank you.
Well, first, let's start with you, Shari. Can you tell me where we're at with some of the rules that we're seeing and why they're significant?
Right. Well, the AAIHR is the only trade association that represents recruiters and employers of internationally educated nurses. And over the years, we have introduced a code of ethics. We introduced the first code that ever existed for an organization in the U.S. in 2008. We updated that code after the WHO had introduced their code of ethics in 2012, and now this is our latest update to the code of ethics.
Okay, and what are some of the things we really should make a note of, Bill?
Well, I think the most important change we're making is we're adding an independent review board to review grievances, if anybody has any grievances, hopefully with an eye toward mediating and problem solving, but also to be developmental for the members to improve our practices as an industry. But the code gets into very specific improvements around retaliation and coercion kinds of practices, discrimination kinds of practices, contracting specific kinds of practices, just to make sure that the interests of all the parties are appropriately addressed, and that there's fair and ethical and socially responsible practices by our members.
Okay, and was this expected by your membership?
Yes, I think that with the growth in international healthcare professionals coming into the U.S. to address our worsening shortages, we've seen an increase in the demand for these folks. And as such, we felt it was an appropriate time to update the Code of Ethics. I think that what we have seen in general is that in the U.S., we have a lot of protections for employees. And so what we're trying to communicate through the Code of Ethics is what are those protections? What should you expect in terms of fairness and transparency with the person employing you, as well as having a Code of Ethics for the international healthcare professional, and holding them to some standards as well, because I think that ethics and the Code of Ethics needs to be interpreted for various different cultures.
Okay, and can you give me a specific example of how life might change for members with this in place now?
Well, first of all, I think that anybody that's a member of our association subscribes to the code. It's part of being a member. And so we've been living with the Code of Ethics for many years. But what's going to be different is that instead of someone complaining, if they did have a complaint, to the association directly, we're going to have a group of independent review folks that are knowledgeable people in healthcare, and specifically people that have worked with foreign educated healthcare professionals, to review the situation to say, is this really a question of a violation of our code, or is it not? And if it is, then to work with all the parties to resolve whatever issues may be in place. And I think that having that independent review board is going to be a new change for our membership, and so that'll be the biggest difference for them, I think. For the healthcare professionals, I think they'll have somebody that's an independent party that they can go to, which I think will give them reassurances that they're going to be treated fairly in the discussions.
Mm-hmm, mm-hmm. And Shari, do you have a final word you want to add on that?
Well, I just think that what the association's trying to do is really be a leader in the industry to reassure both the healthcare professionals and our clients here in the U.S., the healthcare organizations, that we want to provide this opportunity for both of them, but we want to do it in a fair, ethical, and socially responsible way.
Right, Shari Costantini, Bill DeVille. Thank you so much to you both.
Thank you.
Thank you.
Thank you. And thank you for staying with us. We have more to come. Stay tuned.